Good morning, everyone. My printer is making a lot of noise these days, so I apologize if you can hear that noise. I'll be right back. Hold on. I have a crew of guys coming to do work in my kitchen, and they are arriving supposedly at 9. And I just unlocked my door for them so that they can come in on their own, which we discussed last week, but it is the first day that they're arriving. So they may not remember to do that, or they may not like feel comfortable doing that. So if my doorbell rings, I'm gonna run out and like uh bring them in, and then I'll be right back. So I apologize if there's any disruption there. It's a pretty small job, so they shouldn't really need me to do anything for it, like to explain anything for it. So, um, the contractor, Francis, I was just saying that, I have a small crew of guys coming to do work in my kitchen, and they're supposed to be arriving any minute. I unlocked the door so that they can just come in on their own, but, they may, it's their first day arriving for it, so they may not like feel comfortable doing that or something. So if they ring my doorbell, I'll have to pop up and let them in and talk to them for a second. But it's a pretty small job, and the the guy, the lead contractor guy, definitely knows everything about it. So I don't really have to like talk to them and get them comfortable here. I just have to let them in and let them get started. So we will see what happens. And also my printer is going, and it is, I guess it's dying. I don't know. It makes so much noise. It's incredibly annoying. But anyway, um, let's get started with questions. So Frances posted her questions in the so so each week when we're doing this, I try to post a reminder for you guys in Mighty Networks, because the week gets away from everybody, and like even if you thought that you had questions that you wanted to bring up in a Q&A, sometimes like you don't even realize that it's approaching. So I always make a comment in the post that is for posting questions in, and then I also post just a freestanding question, or like little comment in the feed that has the post for posting the questions in it. And I know that's confusing. The reason I do it is that that's the only one that will let me notify you guys. If I post in the post where you're supposed to put your questions, it'll just show up there, but it won't send a message out to you guys and remind you. Whereas if I post in the feed itself, I can set it up to ping you because I'm an administrator, and it's just, it's just the way that Mighty Networks works. So I always figure that it's worth putting a post in where I can send a message out to remind you guys. And I always put into that that's not where you're supposed to post messages. You should look for the post that's set up for questions. Now, this is like slightly different than we've done it in the past. Starting this year, we're doing it this way. We previously used to have you guys posting questions in the event where the Zoom link is, but those questions just pile up, and all the previous ones are still there. And this is much more clean, where only new questions for this specific week will be posted in the questions post for this week, and then there'll be a new post for the next one, and so on and so forth. So it's like a cute blue um, graphic that says Team Amy's office hours, hosted by Sarah Coles McKeown. Submit your questions here, and then it has like my face. with my straight hair um, in in it, and so you should be looking for that. Even though I post something um, separately, it's just because that's the way that I can notify you. Um, so I do try to see if you've posted questions in the wrong place, but the reason why you want to post your questions in the right place is that that's the place where you know for sure I will see them and I will answer them. If they get posted in other places, I might miss them and I might not answer them. So, um, I got an anonymous question, and I feel like I saw this question before, and I guess I didn't answer it, but I really don't remember. It might have been because I answer all the questions. It might have been that it was posted in the reboot food Q&A, and it's not a food question. Sometimes I don't answer questions there when they're unrelated to the reboot itself. But anyway, if you posted this question in here before and I didn't answer it, I apologize. So this question says, I'm wondering if changes in hormones can make you taste different down there. So she means like the taste of her vaginal fluids. Um, and if there's a way to alleviate that. I feel like my taste has become more tart, but she says there are no dietary changes or anything that she attributes to that change. She says she eats fairly clean, has minimal sugar and dairy. It makes her self-conscious about sex. And she feels like it's something that she's been experiencing since her periods got shorter. She says she's been tested twice for BV and STIs, and those have come back negative. So, there's the main thing that I think is probably at play here is changes in estrogen. Um, the fact that it's linked in your experience to a transition where your menstrual flow is shorter, it it is possible that it's something else. So we'll talk about like a couple different things. But um, one of the things that happens as we get older, you know, I always think that the way that our kind of cultural understanding of a woman's reproductive menstrual experience is like presented to us is pretty like uselessly oversimplified. Um, and so we are kind of like taught to think that there are sort of like three major things that happen in a woman's life, right? There's puberty, there's pregnancy, and then there's menopause. And that other than that, like everything is kind of the same all the time. And that's really not true. Like we are actually like always kind of on a trajectory from the beginning of our reproductive capabilities in our teen years to the end of our reproductive capabilities some point in the future. And there's a lot of change that happens during that time. And you can experience a lot of change that doesn't like mean that you have stopped being fertile or something like that. And it can be partly because we're taught such an oversimplified way of thinking about our menstrual cycles and our experience, and partly because like there's both no information and like way too much information to wade through. Like it can be really hard to understand whether something that changes is healthy and normal or a sign of something pathological. So if you think that the taste of your fluids has changed, I'm going to guess that you have had someone say that to you, although you might be tasting them yourself. That's like not a problem. And certainly after someone comments on it, you probably do. But um, that would suggest that it's a sexual partner that you've had for a long period of time and that they are commenting that something that tasted one way in the past now tastes different. Um, if you are not talking about having a long-term sexual partner like that, then maybe you're talking more about smell than taste, or maybe a change in smell is what has prompted you to taste. And then that is kind of what you have noticed. Um, You know, a outside of a pathological problem like a disease or an infection or something, the way that you taste is normal. And I would hope that nobody is telling you that they don't like it or that they find it unappealing or making you feel uncomfortable about it in any way. I think that's pretty misogynist and like inappropriate. Now, I'm not trying to like say anything negative about your long-term partner or anything, especially with a long-term partner, especially someone who loves you. Like, I hope that it would be more of a just awareness of change or like mentioning it to you because you're close and he cares about you or she cares about you. And, um, they just sort of wanted you to know. And then I would hope that you would not feel too uncomfortable about the fact that things have changed. Um, the reason I say estrogen is the main thing that I would say hormonally has contributed to this is that that kind of like lifespan of, our reproductive years is one where we kind of like start out with kind of our most consistently high estrogen levels and somewhere in the 40s. Some people start earlier in their 30s, some people even earlier. We do start to have a trajectory that's kind of downward in terms of the amount of estrogen. That estrogen is produced by follicles in your ovaries. And so as your number of follicles starts to diminish, even if it's not impairing your ability to get pregnant in any way, but where someone might used to have 20 or 30 follicles at the beginning of a cycle that would perk up and just like get a little enlarged, they would be putting out a little bit of estrogen. If you're, later on, you might have 5 or 10 or less than 5. And so even just the amount of estrogen that's put out early in your cycle by those little follicles that have perked up a little bit means that your estrogen levels, even in your follicular phase, are like trending lower. Um, and that that is, it's just it's part of time passing. And it does impact menstrual flow. There are some women whose bodies respond to this by having much heavier, much longer. Oh, there's my doorbell. I'll be right back. Yep. Okay, I'm back. They are in and working. So, as you're so there are some women whose bodies respond to this change in estrogen with a longer, heavier cycle. And I specifically mean the blood flow itself, not necessarily the length from day one of your cycle to the last day before you bleed again. Um, Although the length of your total cycle can also change. But it is more common for women's menstrual flow to become less, a little more scanty, fewer days, less volume on the days that you are bleeding. And so, because you say that this change has been associated in your mind with a change in your menstrual flow, I do think that it's probably a decrease in estrogen. So, depending upon what you're doing and who you're doing it with in order to conceive, you might be able to address this by uh, increasing your estrogen. Now, if you're here talking to me, you're trying to conceive. If you start using estrogen, it could keep you from ovulating. So we have to be cautious about how and when we use it. But there is vaginal estrogen cream that you could use, or vaginal estrogen like tablets that you insert higher up into your vagina, or you could use a transdermal patch. Those would be kind of the primary ways that you might do it. You can also take estrogen orally, but I think it's preferable to use it in a patch to orally, both because there are fewer side effects for people who are sensitive to it, like headaches and things like that, and also because the um, risk of blood clots is like highest from oral estrogen, and it's not increased with the other methods, vaginal and transdermal. So from a hormone perspective, I would say we could work on estrogen. We can work on improving your estrogen in other ways, but there may be a way to use estrogen hormone replacement to help with this. Now, as a perimenopausal lady who uses vaginal estrogen, I can tell you that when I started using it, um, I noticed a change in the odor vaginally. It was very like I'm pretty aware and sensitive to these things because I talk to you guys about them all day long. Um, and so I'm pretty aware of my body. And I was also really 100% certain that it wasn't a pathological change in smell, that I didn't have an infection or anything. But it was enough that when I went back to see my menopause specialist for my checkup, that I mentioned it to her, and she immediately said, yes, that's because you started using the estrogen, which was what I thought, but you always bring stuff up to your doctor. So I know from personal experience that this is definitely something that estrogen will do. Now, that was me saying that once I added estrogen back, I noticed a change. And that's because without estrogen, um, things get drier and yeah. So the next thing that I think this could be caused by would be a change in pH, which would not be necessarily it's not an infection. You wouldn't necessarily have any like discomfort or like change in how you feel. But you could have a change in your pH, and it could be related to products that you're using without even really realizing it. Even if you're not scrubbing with a body wash or something that's like not designed to be used vaginally and in your like vestibule and vulva, you certainly could be getting those products up there. So they do make products that are designed for cleaning. Um, the genitalia that are like not a fragranced sort of like old school kind of beauty product, but more of a product because a lot of us grew up feeling like we needed to use soap or body wash or something there, and we don't feel 100% clean in the shower unless we also wash there. So you can look for a good vaginal wash, and you can see if that, using that specifically, changes, you know, how you're washing and if that has some effect on your pH. You could also try doing a course of vaginal probiotics. So not just taking an oral probiotic that has specific strains in it, like rhamnosus, that are tested and like known to have an impact on the vaginal flora, but actually a probiotic that you pop up in there. Um, there are a few different brands available. Seed has one, but there are other ones. And usually you do a course for like a month and see if that changes the pH at all. If you have a new sexual partner, and you have noticed the change since you have been sleeping with him, usually, it is also possible that you're having like a change in pH that has something to do with him. And so it's not the same thing as like catching something from him, but his seminal fluids, if you're having unprotected sex because you're trying to get pregnant, um, could be something that you are responding to in this way. It, you know, it could, yeah, it could be related to him as well. So, the two things that I would think about first would be estrogen and pH. Now, from the perspective of like trying to change things, other than trying to change what's happening, right? Like introduce more estrogen or use something that might change your pH. Certainly, like pineapple is the trendy fruit that is said to change the taste. Um, you don't want to be eating tons and tons of pineapple because it's high sugar, but you could try eating it. I don't think that any of those gummies that they sell on like Instagram and TikTok really do what they say they're going to do. I know the Kardashians have a gummy that they say will do something. I think that's not really real, but you could try eating some fruit and see if that changed things. And I don't think pineapple's the only one that you could eat. You could really eat any fruit, but you do want to pay attention to the like amount of sugar that you're getting. And then other things that you don't necessarily need to avoid, but that you might play around with and see if you notice a change. It's like if you eat a ton of garlic, if you eat a ton of onions, things like that, if you eat them more raw, um, those are things that will change the smell of your sweat. So they could also change the taste of your fluids. I don't think it's the most likely thing unless you really, really eat a ton, but it definitely could. So that's the answer to that question. Um, and give me one second. Oh, actually. Um, all right. So Francis, the rest of the questions are all yours, and they are almost all kind of like related to the egg quality diet. And I think you are on vacation right now. I know you said something about hoping your signal would be strong. And I think you were traveling before doing the egg quality diet. So, um, Francis says that you're in the beginning of your fertile window and you're in Portugal. It's so exciting. Great place to vacation and to have sex. Um, you're going to try using progesterone cream starting post LH peak. That's great. Start 48 hours or 2 days after your LH peak. Um, and you're planning to start the egg quality diet when you get home, and then you have a few questions. So, um, first question, you have been using ashwagandha transdermally for about 18 months before bed. Um, and in the egg quality diet, ashwagandha is one of the nightshades that we avoid. So the egg quality diet is 4 phases. The first phase is a prep phase that is set up to be about a week. I do have some people who end up needing to do it over 2 or 3 or more weeks because their lives are complicated or their diet is so different from the egg quality diet that they need more time to prep. But there are other people who can do it faster because it's not as big of a transition for them. And it can be just a couple of days to like get, some shopping done and sort of like plan for doing phase two. Phase two is the hardest part of the diet. It is only 11 days, but it is the most extreme in terms of elimination. You have the fewest number of foods available to you during phase two. Phase three comes right after phase two, obviously, and it lasts 30 days. It lasts 4 weeks. And it is a much expanded amount of variety of food compared to phase two, but it is not the reintroduction phase of the egg quality diet. So in phase two, you are limited to um, if you're doing it exactly the way that it's written. There are always people who have to make some modifications because of allergies or religious restrictions or other things that they have to take into consideration. But if you're doing it exactly as written, you're limited to a couple of varieties of fatty fish like cod and salmon, and then a couple of varieties of red meat like lamb and beef. And then you're not eating other animal proteins other than eggs, and it's only egg yolks. Um, and then you are eating um, most of the vegetables, but you're not eating things like onions and garlic, and you are not eating any nightshades, and you're not eating any fruit. You're not eating, yeah. So, when you hit phase three, those are the areas that expand. So it's not the reintroduction of the potentially inflammatory foods phase. That's phase four. But phase three, you get all your animal proteins back. You get all your vegetables except nightshades back, and you get all your fruits for the first time except for nightshades. And then phase four is can take any amount of time. Some people are able to do it very fast because they end up not being reactive to foods. Some people who are extremely reactive end up doing it slower, and the whole diet takes longer than 100 days for them. It's really depends. But that's where you start reintroducing things like nuts, seeds, beans, grains, nightshades, etc. So that's just like a little kind of structure of how to think of the diet. In addition to being the most restrictive in terms of the variety of food that you eat, phase two is also the phase where we restrict supplements. So your question about ashwagandha has a couple of different layers to it in terms of the egg quality diet, because the Um, in phase two, we ask you not to eat any or not to take any supplements. You can take all your prescription medications, like and even like over-the-counter medications that you need. Um, we're not restricting those, but we are restricting supplements. So that means you're not going to take your prenatal, you're not going to take your fish oil, you're not going to take your melatonin, you're not going to take your CoQ10, you're not going to take your magnesium, you're not going to take any of this stuff. And that would include ashwagandha. So in phase two, you would stop the ashwagandha. Now, if for some reason somebody has like a really, I'm going to use melatonin as the example, like they have a really precarious sleep situation where they have worked really hard to find a way to improve their sleep so that they, you know, can survive, right? And not be miserable. They may make a decision that they are going to make a modification to the phase two, instruction to stop all supplements and stop all their supplements except their melatonin or whatever the supplement is that they find they need in order to sleep. And that's not ever going to be something that is like recommended in the book, because when you start recommending modifications, then everybody modifies too much. And I always say like it's already hard to put in the effort that you need to put in to do the egg quality diet. Like it's hard, right? I am always so impressed and like so I always give you guys so much credit for doing it. But even worse than putting in all the effort is not putting in all the effort, but feeling like you did, because you will feel like it was hard, and then also not benefiting from it. So we try not to encourage modifications, even though we recognize that obviously there will be some people who need to make some modifications. The key here is to not make them unnecessarily and to not then take one modification as a kind of like the beginning of a sort of spiral where you make lots and lots and lots of modifications. So in an ideal world, you're not going to take any supplements for those 11 days of phase two, and then you're going to reintroduce them in phase three. And most people can reintroduce them pretty like quickly together. It might take them 2 or 3 days to start taking them all. They might not take them all again just on the very first day. But other people who are more sensitive to supplements or who have wondered if they're having side effects from any of their supplements may choose to introduce them much more slowly. And so there are some cases where someone will introduce one at a time in phase three, even though they were taking the supplements previously. And it really depends upon your body, how you decide to do it. So transdermally versus orally, I think that I would try to skip the ashwagandha during the 11 days of the of phase two, unless you have found that it is incredibly helpful for something that hasn't sort of rebalanced in your body, so you feel that you still need it on a daily basis. Or if you had to work up to taking it and you are um, you don't think that you can just easily go off of it and back on it, you might decide to take it during phase two. Ideally, I would say don't take it during phase two. And then because it is transdermal, you may be able to use it again in phase three. It wouldn't be doing the egg quality diet exactly as written, because it is not just a supplement, but it is a nightshade. And further than that, ashwagandha is a adaptogen. And so I just was emailing with a girl about this over the last week or so. She has Hashimoto's, which is autoimmune hypothyroid, and she has read that ashwagandha would be good for that, so she wanted to take it. She may have even gone to a naturopath or something who had recommended it. And I was saying, well, like actually, this is really complicated, and I can't probably explain it sufficiently for you guys here, but Hashimoto's is a Th1 dominant autoimmune condition. There's Th1 and Th2. These are aspects of your immune system, and they govern sort of slightly different reactions and sort of responses in the body. And because ashwagandha is an adaptogen, sometimes people who have Th1 dominance will actually have like a negative response to adaptogens. And so I was asking her questions about how she's been feeling since she's been taking ashwagandha. And she's actually had disruptions to her sleep. So even though you might Google it and read that ashwagandha will help you sleep and help you get deeper sleep and help you relax, it's not actually working that way for her. And that is probably because of the Th1 dominance of the Hashimoto's. And so I suggested that she stop it. And then once she stopped it, she actually has been sleeping better. So, like ashwagandha is complicated, but you're going to be deciding whether it's something that you really need, and therefore you're going to make an exception for using it, ideally not in phase two, but in phase three and phase four. And then you're also going to pay attention to how you respond to it, because, taking it out, even if it's just for 11 days and bringing it back in, you might discover that you have some kind of reaction to it that's not like an allergic reaction, that you didn't know before. But because it's transdermal, I think it's a little less serious than if it was oral. And the main reason for that is that the egg quality diet is designed to do a couple of things, right? Like it is designed to help you to eat the nutrients that are supportive of fertility in the quantities and like ratios that is most supportive of fertility and specifically of egg quality. It also is an autoimmune, anti-inflammatory elimination and reintroduction diet designed to give your gut a break in dealing with foods that cause inflammation, to allow your gut to heal so that there is less or no inflammation. And then no is probably a pipe dream, but dramatically less. And then reintroduce one at a time the foods that are the most likely to cause reactions and inflammation, and allow you to learn what the specific foods are that you are reactive to, so that you can avoid those foods and have the largest variety of foods available to you otherwise, right? Even though the diet itself involves restriction, elimination, the goal of the diet is the least amount of restriction for you in the future. So that's all about gut health and using the ashwagandha transdermally. It's not going to go into your gut. So it's not going to directly cause or contribute to or prolong inflammation in your gut. But it is possible that it could impair some of that healing if you are reacting to it in an inflammatory way. Hi, sweetie. I know it's weird having people here in your space. I had to move her litter box and her food. So she's having a rough day. Um, so yeah, so I would say, if possible, skip it in phase 2. If you want to try using it in phase 3 because it is transdermal, I think that that could be okay. Just pay attention and see how it goes. Um, Next question is about magnesium. Um, in the Equality diet, it's recommended transdermally. Yes, you can definitely use a magnesium cream at night. The one that your Ayurvedic doctor has recommended looks totally fine. Again, it's transdermal. It does have more ingredients in it than it strictly has to just to provide magnesium. You can actually do a magnesium oil that is like probably like 2 ingredients. Amy has a magnesium oil. She calls it McKeown's. The like OG brand is ancient um what is it called? Ancient Minerals magnesium oil. And I'll just pull that up and like look at their ingredients and see what's in it because it's pretty minimal. But there are others, like Now has a magnesium oil as well that I often recommend. Designs for Health used to have one that was more like a gel. Um, but I think they stopped making it. Now, where are the ingredients here? Um, yeah, here we go. Pure magnesium chloride, purified water. It's just 2 ingredients. So yours has more stuff in it, and specifically it has like it has camphor, it has glycerin, it has some scents, right? It has whether they're used for their smell or for their properties. It has grapefruit, ylang ylang, and sweet orange in it. So probably a magnesium oil that is only 2 ingredients is like the safest bet. But if you've been using this and you haven't been reacting to it, I think it's probably fine. Um, Next question is about coconut milk yogurt. So you've been eating Coco June, and it does have tapioca in it. It's funny, I just did this whole thing with coconut yogurt in last week's reboot Q&A. Let me just pull up because I have a whole list of them. And Coco June is one of the ones that I do like. The one that you, here we go. Coconut Cult, the one that you found to be more pure is like kind of the top one. But I thought that there's a Coco June product that doesn't have the tapioca. So let me just look. I'm pulling up their website. No, it does. Yeah, so what I do in that Q&A is I go through a couple of different ones, sort of from like best to worst, and tell people kind of like what makes one better than another. Coconut Cult is really good. Um, Coco Yo is also good. This brand Cocoyo. Their website is gtslivingfoods.com, and then the product is Cocoyo, Cocoyo Pure. It's a raw coconut yogurt that's just made of fermented raw coconut, nothing else. Um, the coconut cult is kind of similar. Cocoa June is sort of like one step down from that because it has the tapioca in it. So this is again a question that's kind of like the sort of question about the ashwagandha. Now I'm scrolling back. Um, where like in phase two, I would not be eating something that has tapioca in it. Because it's not allowed in phase two. So the question becomes like, can you make your own coconut yogurt? There is a recipe for it in the Egg Quality Diet book. Or can you find cocoa or coconut cult and eat that instead? Now, everybody has different limitations, right? Like we have limitations in terms of time, we have limitations in terms of money, we have and limitations in terms of access and availability of things. And like doing something for 11 days may be possible. Doing it for 100 days or for the rest of your life may be harder. So there may come a time in phase three or beyond where eating the cocoa or the coconut cult is not really feasible, or where you're not able to make your own coconut yogurt and you end up deciding that you need to have the product that has the tapioca starch in it, even though you haven't like gotten into phase four all the way and like reintroduced everything. And so that would be a modification that you might decide that you need to make, and that is okay. Um, you're going to be looking for a product like Coco June, which is why I have it in my list of recommendations, that doesn't have a lot of other stuff in it. If the tapioca starch is the only thing, then it makes it a really viable modification that you could do. So I would try not to do it in phase two, but I do think it is an option for phase three. And then it's exactly like what I said about the ashwagandha, where you're going to try it and then you're going to see how it goes. Like if you respond well to it, then that's great. And if you discover that you have any issues with it, then it's a little less great, right? And that's really going to be the case with a lot of things. Now, the coconut yogurt becomes a giant issue in phase two because the number of foods that you have available to you is so limited. And because coconut really is basically the only kind of sweet type of food that's available. Yes, sweet potato technically does taste sweet, but it doesn't like satisfy that like breakfasty itch or that desserty itch. It's very much a vegetable, right? So it's uh it's something where you will oftentimes really crave the coconut, really, really want the coconut. Now, every once in a while, there is a girl. I don't expect it from you. I don't expect it from most people, but every once in a while, there is a girl who has eaten coconut in her life, but it hasn't been a major part of her diet. And then she gets into phase two and she's eating this very limited diet, and she's eating coconut oil and coconut milk and coconut cream and coconut yogurt. And she's eating a bunch of coconut, and she discovers that she's sensitive or allergic to coconut. So, like anything can happen. The goal of the foods that you're allowed to eat in phase two is to eliminate the foods that people are the most reactive to. But that doesn't mean that any one individual person couldn't be reactive to something else, right? Like there's variation in all things. So with anything, especially when you start eating a lot of it, just pay attention. When you get into phase four and you start reintroducing foods, I always talk about there is reintroducing the food and discovering that you have a reaction to it, and then discovering that you cannot eat that food or should not eat that food. Um, there's also preparation, quantity, and frequency, and all of those things matter. So the two examples I most often use to sort of like make this make sense is almonds and tomatoes. So you could reintroduce almonds and you could define eating physical almonds as a snack. But then you could reintroduce almond milk and you could discover that actually, if you have like a giant latte full of almond milk, that you are reactive to that. Or you could reintroduce almond butter and you could discover that when you throw a giant, couple of tablespoons of it into your smoothie every day and you have it in like fat bombs and other things that you're reactive to it like that. And then you kind of have to question like, what's the quantity and what's the frequency with which you're eating that? Could you tolerate almond milk in a smaller quantity less often? Could you tolerate almond butter in a smaller quantity less often since you are not reactive to the nuts? That might be the case, and that might be okay. Tomatoes are another really classic example where it is quite common that someone will reintroduce tomatoes and discover that they can eat raw tomato like in a salad or on a plate um, without any reaction. But that when they start to eat slow cooked, long cooked, like marinara sauce, tomato sauce, that then they have a reaction. And in both of these examples, the amount of almond proteins that you're getting exposed to in a giant cup of almond milk or in ground up almond butter, or the amount of tomato that you're getting in a marinara sauce, it's a lot more than when you were just eating a few tomatoes or eating a few almonds like whole. And that can be why you're having the reaction to it. So just like reintroducing something, sometimes it's a full hard yes or no, and sometimes it's a with qualifications yes. And you'll just be learning all of those things as you go. And then your last question was about phase 2 and pregnancy. So there's nothing about the nutrition that is recommended in the egg quality diet. That means the macros and that means the foods that are stressed, right? Animal protein, healthy fat, vegetables, some fruit. There's none of that that is contraindicated during pregnancy. It's supportive of pregnancy. So if you are on the egg quality diet, um, and you have been for a while and you're doing well on it, there's really no need to stop it when you get a positive test. The one thing that I would say is that we tend to up the amount of carbs that people are eating, especially in the first trimester, but really throughout the whole pregnancy. So you will relax the macros a little bit to allow yourself more carbs. Now, that doesn't mean go completely bananas and just start eating all the carbs you want and like stop paying attention to the macros at all. But it definitely is an area where we make a modification during pregnancy. Now, what I always say is if you're just starting phase 2 and you get a positive pregnancy test, like please skip ahead to phase 3 or even phase 4, and like eat the foods that are recommended and follow the macros that are recommended, but don't go through the whole elimination process. If you haven't done phase 2 yet, or you're only a few days into phase 2, you're at the very, very beginning of this diet, and you're also at the very, very beginning of your pregnancy. And like, there's just no need to stress yourself and your body and everything out by going through this challenging elimination process in these very early days and weeks of pregnancy. Like, nobody needs that. And you can benefit from eating according to the diet just fine. Now, um, that doesn't mean eat foods that you know don't make you feel good. Like, even if you haven't done something really scientific in terms of elimination and slow reintroduction in order to determine what foods you're reactive to, you may know that there are some foods that you just don't do all that great with. And I would say just don't eat them. Like, why take the chance, right? My poor cat is like, she's not happy. Baby, come here. Come here. I know. So many noises. It's so scary. Yeah, so that's kind of, I think, the answer to the questions that you have. If you are still here, it looks like you are. Let me know if you want more clarification on anything specific, or if there's anything that I haven't answered. If you have additional questions about the egg quality diet or anything else, Francis, of course, I will be happy to answer them. And hopefully you guys have been able to hear everything I've said, even with some of the noise here. And I will just cuddle this little girl inside my sweater. She's, she's a very good girl. You're not a fraidy cat, but you know, she's an old lady. Um, all right. Um, let's see. Francis has another question. The only question you have is, with phase 2 and a positive pregnancy test, would you keep taking your supplement? So when you are pregnant, the two supplements that are the most important to take, so this applies to like somebody who gets really nauseous or, anything, right? Um, we want you to be taking sufficient methylated folate. Some people are taking another bioavailable form that's not folic acid. That's the most common one is called folinic acid. That's fine too. But we usually shorthand it to say methylfolate because that's the most common. We want you to be taking sufficient methylfolate, and we want you to be taking sufficient omega-3 fatty acids, usually from a fish oil. And the specific one that baby needs for brain development is DHA, which is not DHEA. That's not an omega-3 fatty acid. That is a precursor to androgenic hormones. That's a totally different supplement. But in your fish oil or in your omega-3 supplement, you want to see that you're getting at least 500 milligrams of DHA per day, because the baby needs that for brain development. So those are the two supplements that you really need to be taking, even when you are like really, really nauseous, which not everybody is, but some people are. We're trying to find ways to make sure that you can get those things. And like, even though they're not my preferred supplements, if the girl can only tolerate a gummy, there are some gummies out there that are not as bad as others. And like maybe you're just taking gummy supplements in order to get those two things down, and then everything else is like skipped. So if you got a positive pregnancy test when you were in phase 2 and you weren't taking any supplements, I would have you add back in the prenatal or methylfolate and the fish oil or DHA immediately. And then how fast we would return the rest of your supplements and whether we would return all of your previous supplements would kind of depend upon what they are. And if you coach with me, I always say, like, send me the traditional simple bulleted list by email that I always ask for, that says brand, product, dose, and frequency, one line for each of the supplements that you're on. And then I can edit it and send it back pretty quickly, edited for pregnancy. Um, there isn't a risk if you are, like, I wouldn't be worried about stopping your supplements on phase 2 because you could find out you're pregnant at any moment. Because I've just said that we need you to be on the methylfolate and the fatty acids, the DHA. Those things don't like disappear from your body. They're not on like a timer, right? Like, it's not like if you haven't had a pill that has those things in it within the last 12 hours or 24 hours that then you are like down to zero. That's not how it works at all. And the fact that you've been supplementing with them for a long time means that you can safely take a short break, like the 11 days of phase 2, without the supplements, and your levels of those things will be completely fine. We just don't play around with like taking lots of breaks from things, because everybody's body and digestion work a little bit differently. And everybody's ability to comply with making sure that they take something on an irregular schedule is different. Like, I find that if I go away on vacation for a weekend and I don't take all my supplements with me, that sometimes it'll be like a week or two later that I'm like, oh, wait a second, I never started taking X again. And it won't even necessarily be something that I hate or whatever. Like sometimes it's just that for whatever reason our brains like can just like simplify really fast. So part of the reason why you take something every day is for making it easier to comply. um let's see, right now you recommended that I take methylfolate 3 times a week. Would I increase that? So that would be because it's either because of the dose. I have to pull up your chart to so she says, right now you recommended that I take methylfolate 3 times a week. And that's going to be because of the dose or because it is in addition to, yeah, here we go. So you take the ritual prenatal, and the amount of methylfolate that's in the ritual prenatal is not as much as I would like you to be getting, but there is methylfolate in the ritual prenatal. So you are taking your prenatal, which includes the lion's share of your methylfolate supplementation daily. And then what you're doing is you are taking an additional methylfolate supplement 3 days a week, because when we average out the 3 milligrams of additional methylfolate that you get from that, now we have increased the total kind of average daily amount that you're getting to the amount that we would recommend. So you are actually taking methylfolate every day, and then you're taking additional methylfolate 3 times a week. And in the email that I sent you, I actually I most recently, this was like January 17th, I was dividing up your supplements into kind of groupings, right? This is something else I do for people, in addition to just like editing their supplements for pregnancy or for other changes like starting IVF cycles or transfer cycles or things like that, that sometimes people are looking to reduce the amount of money they're spending on supplements or reduce the number of pills that they have to swallow, or I think that they have too much redundancy. Even though they're not taking doubles of exactly the same antioxidant, they might be still taking so many antioxidants that I think it's excessive. And so I will sometimes like divide up your supplements, organize them for you in kind of categories, right? So for her, I divided them up and I said, these are your primary supplements. And the ones that I put there are the ones that I've been talking about: the ritual prenatal, the additional methylfolate, and her fish oil, right? Those are the primaries. Those are like the most important. Then the next ones I put for her were her secondaries. And then I had tertiaries and lowest priority. And then I also, for her, organized it by saying which ones should be discontinued when she gets a positive pregnancy test. And then sometimes there are ones where you could go either way, and I like leave it up to you. The Another way that I sometimes organize them is into categories that specifically like tell you what their function is, right? Like if I think the person is taking too many antioxidants, I will list out all the ones that have an antioxidant function, and then encourage the person to consider simplifying in that area. I do think that supplements are really beneficial and helpful, and obviously I recommend them. I recommend a lot of them, but they are supplements, right? The name says that they are supposed to be used in addition to the nutrients that you get from your food, not in place of nutrients that you get from your food. And that there is there is a limit to how many can be really effective. So beyond a certain amount, it can be kind of excessive, and that will be different amounts for different people, in part or in large part based on their digestive ability to like break them down and absorb them. So, yeah. So you wouldn't need to increase the amount of methylfolate you're taking in pregnancy, Francis. You would just continue to take both your ritual prenatal and the additional methylfolate that you're taking now. All right. I think that is all the questions that I have. So hopefully that has been helpful. Um, and let's see, posted another question. I do have to go on time, but let me see what this question says. How much would the average amount of methylfolate be that I would want to be taking? I am taking the thorn medication during phase 2. I don't know what you mean by the thorn medication during phase 2, but in general, the amount of methylfolate that I would be recommending would be somewhere in the range of one. Yeah, but you're not taking, okay, so it's not a medication, it's a supplement if it's made by Thorne. It is important to separate things out in your head from medications and supplements. And then you're not taking that during phase 2. You're not taking the Thorne methylfolate in phase 2 because it's a supplement and you're not taking any supplements in phase 2. But the amount of methylfolate that we are looking for you to get in a day, like an average amount, for the most part, is somewhere in the range of 1.5 micrograms, which is, or sorry, 1.5 milligrams, which is 1,500 micrograms. Some of the really good quality prenatals only have about 1,350, and some will have more like 1,800, and that's fine. But that's really the range. There are some people who have MTHFR, and they have doctors who put them on a higher dose, usually using a drug called Metanx, which is a prescription folate supplement. It used to have a higher amount, I'm pretty sure, but now it has 3 milligrams, which is 3,000 micrograms. And I think that that is kind of excessive, but if the doctor prescribes it for them, like usually I am okay with it, but then we are in a situation of trying to figure out whether we're going to take them off of prenatal so that they're not getting an additional like 1,500 there, or whether they're going to do both, so on and so forth. But what you're looking at is around 1,500 or 1.5. Sometimes it's written in micrograms, sometimes it's written in milligrams. They just, you know, they go back and forth on it. Anyway, it's nice that you popped in from Portugal. I hope you're having a really lovely time, and I hope everyone has a great weekend. And I will see you for the next Q&A. Bye, guys.